Welcome to The Explainer. Today we're going to break down a really common medication that has a surprisingly complex job, cimetidine. We're going to find out how it can tackle both stomach acid and allergic reactions.
So let's just dive right into the question that makes this drug so fascinating. I mean, think about it. Painful stomach ulcers and a bad allergic reaction. They seem like they're from completely different worlds, right? So what's the deal? How can just one pill be the answer for both?
Well, the answer is a medication called cimetidine. You might know it by its brand name, Tagna.
Okay, so the secret to understanding cimetidine is right here in its job title. It's what's called a histamine 2 receptor antagonist, or an H2 blocker for short. The best way to picture it, think of it like a super specific signal jammer. It's built to interfere with just one kind of message in your body, a message carried by histamine. So let's talk about its first job, blocking acid. The way it works is actually pretty cool, and we can break it down with a simple analogy, a key and a lock. So here's how it goes. Normally, you've got histamine floating around, and it acts like a key. When that key finds the right lock, in this case the H2 receptors in your stomach, it turns and bam, it tells your stomach cells to start making acid. What cimetidine does is it comes along and basically shoves a piece of chewing gum in the lock. The histamine key can't get in anymore. And if the key can't turn the lock, the signal to make acid never gets sent. Simple as that. And it gets to work pretty fast, too. You'll feel its peak effects within about 1 to 3 hours, and that acid-blocking power sticks around for 4 to 5 hours from a single dose. Okay, so we know how it works. But the next big question is, when do doctors actually pull this tool out of the toolbox? Let's look at its main mission and, just as importantly, its limits. All right, its main jobs are what you'd expect. Treating GI ulcers and any condition where the stomach is just going crazy producing acid. But here's where it connects back to our first question. It's also used as an adjunctive treatment for severe allergic reactions. You see, most antihistamines block H1 receptors to stop things like hives. But cimetidine blocks H2 receptors, which helps manage a totally different part of the body's big inflammatory response. As for when not to use it, that's pretty straightforward. If you're allergic to it or any other H2 blocker, it's a no-go.
Now we've got to talk about something that is absolutely critical for any medication, the safety warnings. It's super important to know what to keep an eye out for.
Now, most people tolerate it just fine, but there are some potential side effects you should know about. Things like a drop in blood pressure, an irregular heartbeat, and in some pretty rare cases, it could cause inflammation of the blood vessels or even a state of confusion. And now for what might be the single most important warning about this drug. Cimetidine is famous, or maybe infamous, in medical circles because it can interfere with a ton of other medications. And this isn't just a small issue, it's a really big deal. So why does that happen? It's because cimetidine is a powerful inhibitor of your body's drug-clearing system, specifically a group of enzymes called cytochrome P450. Think of this system as the main highway your body uses to break down and get rid of drugs. Cimetidine basically closes down a few lanes, causing a massive traffic jam. This can cause other drugs you're taking to build up to dangerous levels. It's actually this one characteristic that often makes doctors choose newer drugs that don't cause this kind of traffic problem.
So, because of all these effects, you can probably guess that getting the dosage right is absolutely crucial, and it is definitely not a one-size-fits-all kind of drug. The dose changes a lot depending on your age.
You can see here for an adult, it's a pretty standard fixed dose, somewhere between 200 and 400 milligrams. But look at this. For kids, infants, and even tiny neonates, it's a whole different story. The dose has to be calculated very carefully based on their body weight, and it's usually split up into smaller doses throughout the day. And there's another really important rule, especially for the youngest patients. For kids, infants, and neonates, any dose that's given during the day needs to be taken with food.
And what about during pregnancy? Well, it's not a simple yes or no. What we know is that H2 blockers, and that includes cimetidine, have been looked at pretty closely for treating things like bad acid reflux and ulcers when someone's pregnant. So it's something doctors will consider. So if there's one big thing to take away from all this, it's that cimetidine is way more than just a simple acid pill. It's a really precise tool that targets one little lock in the body, but blocking that lock creates these huge, widespread ripple effects on our body's chemistry, from our stomachs to our immune system to how we handle other medicines. And that really leaves us with a final thought, doesn't it?
We started with a simple pill that does two totally different things, but what we found was this complex, fascinating chain reaction. It's just a perfect example of how deeply interconnected all of our body systems truly are, where one tiny change in one pathway can have these huge effects in places you'd never expect.